It's interesting that there are different aspects to this. There's a transport aspect, and then there's a health aspect, there's a European aspect, and it's good to have different people from those different perspectives here together. My perspective is that I'm an engineer, so I'm looking at this in the classic idea of what is the problem and what is the solution. So the problem that we have is free movement. People are not able to move easily around Europe, and the knock-on consequence of that is a loss of free movement, a loss of connectivity in Europe, and also damage to the tourism industry. So what's causing that, and how do we fix it? So the cause, and this has been alluded to by other speakers, which isn't often talked about, is that people are arriving at European airports with pieces of paper that say that they're vaccinated or say they've been tested. And it's very hard to determine if those pieces of paper or those screenshots on phones are authentic, are they valid? It's very easy to knock up an A4 sheet of paper, buy one on the internet, or you can make something in Microsoft Paint and stick it on your phone and turn up, and there's no way really to validate it. And part of the problem is the length of time it takes to validate these different documents. So people arrive at an airport, and typically one of the stages you go through is that somebody has to authenticate your passport. And there's a place, there's a mechanism, there's equipment, there's a standard for passports, and it is possible to determine whether a passport is genuine or not and whether it attaches to that person. We don't have that infrastructure for determining whether somebody has really passed a COVID test or whether somebody is really vaccinated. And you can imagine somebody can show up from anywhere in the world. They've got a piece of paper saying that they went to some particular test lab or some particular vaccination center, perhaps privately run, and that they're okay. How do we trust that? And because of that lack of trust, that then translates into member states imposing very strict rules on travel. So it's the lack of trust that leads to the restrictions, and it also leads to inefficiency. And inefficiency in an airport is not so bad when you are only running at 5 or 10% of normal passenger levels. But what happens when we return to the type of volumes of passengers that we had in previous years? They're simply not going to get through the airport in that time. And secondly, there is a problem with the risk of infection when you have thousands of people crowded into an airport, unhappy, waiting to get through because it's taking so long to check all their various documents. So the idea of these certificates is that you have a mutually recognized and acceptable document which can be scanned quickly. So you arrive at a counter, there's a QR code in the corner, somebody scans it, it goes beep, green, you can go through. So that we get the efficiency, but also it's a digital signature. So it's using public key encryption. There's a private key and a public key. We know that that's a genuine document that has been signed by an authority that we trust. In other words, a member state has signed it, and that government is guaranteeing that that person has been vaccinated or has been tested or has recovered from COVID. So that's what the proposed solution is, and it's just important to just keep a focus on that on what we're trying to do. So in January in Ireland, the HSE developed its own in-house vaccination certificate system. They started issuing vaccination certificates to a pilot group of HSE staff, and they've been doing that since. So we had something to work on until the European proposed digital COVID cert specifications were produced. And since then, we've been adapting what we've done to what's required. So we've got two real challenges here. One is technical, so just issuing the certs is one thing, and that's absolutely fine. The second problem is policy. So once you've got one of these certificates, is somebody going to accept it at the other end? Where are they going to check it? What are the rules going to be? So what these certificates say is they say when you got a vaccine dose, which vaccine you got, or else they say which tests you've had and when you had them. It doesn't say whether somebody is going to let you in with this particular document. In other words, it's not a travel document. It's not a guarantee that you're going to be admitted. And every country was allowed, certainly at the start, every country was told that they could set their own individual policies on admission. So every country can determine what's their threshold for admitting somebody. Now, I think we're moving now towards if you're vaccinated, you can be admitted, which certainly seems to make sense. But we're in an evolving policy area between now, 1st of July, and our target date, the 19th of July, where those rules are changing, and they're changing according to the changing risk that's happening. So to give you an example, a topic that's been much in the media is antigen testing. the specification for these, so there are two aspects to an antigen test. There's whether we're technically going to include it on a COVID cert, and then whether it will be accepted by the other government at the other end, at the receiving airport. So the specification says antigen tests can go on. Particular types of antigen tests can be included in the certificate, so they will be. But you might arrive at a country that doesn't accept those antigen tests as being possible to travel. So it is still a complex situation, and it is a challenge. There's also questions began to arise about civil rights. Will these vaccination certs be used to prevent you from going about your normal business? In other words, for go to a restaurant, and we clearly laid down policy at the start that we wouldn't do that it would be for travel. Last week I met transport ministers, last Thursday at the Council of Ministers, and I discussed this both in a group and with individual ministers about the various challenges that were there. And one of the things I got to see was what it's like going through an airport in practice, and it is very inefficient. Going through an airport, there are a lot of people queuing up, and the process of checking the certificates is not. It doesn't look like it's very thorough. There is another issue that arises is what happens when somebody tests positive when they're abroad. How will they come home, particularly on a family holiday? If a group is away on a family holiday and one of the children tests positive before they leave, how are they going to isolate? That needs a sort of an insurance solution. So we have three types of certificate referred to. We've got vaccination certificates, and I'll just give you some information about how we're getting on with them. Initially, vaccination certificates are clearly the most important of them all because they're the longest lasting. After that, recovery certificates, which will last for a period of months, and test certs. And test certificates are very ephemeral. They only last for that couple of days before you arrive in. So they don't really have much value. A test cert from a month ago really doesn't have much value. So with vaccination certs, we're ready at the moment to issue 1 million vaccination certs, which are those that went through our vaccination registration portal. We have another 1.3 million that would be issued based on data from GPs. In terms of recovery certificates, about 250,000 people have, on our system, we have recorded as having recovered from COVID in the last 9 months. So that's another 250,000 that we could issue right away. And for the test certificates, we are working with individual laboratories to accredit those laboratories and to set up data feeds so that when they test somebody, those test results can come in and be used as a signed certificate for people to travel. So the system is being developed in-house. The work has mostly been done by the HSE. It's in coordination with my staff in the Office of Government Chief Information Officer, and there's a senior officials group under the Taoiseach's department that's coordinating between other departments around the government, because of course health is involved, and of course tourism is involved and transport is involved.